One becomes a doctor by first going to college, graduating from college, and getting into medical school. Once you get into medical school, you go through your 4 years of training. Now, your first 2 years are primarily your educational book learning, where you will spend time in a classroom going over your studies, learning the basic science is what we call it, which include how medications work, how infections take place, how different things in the body get disorganized. Your second 2 years of medical school are your clinical rotations, which is primarily where people in the community see medical students. They are doing rotations, which are approximately a month long, in different specialties like family medicine, internal medicine, cardiology, surgery. And they spend time behind a preceptor who is their overseer, who is training them and showing them the techniques of their specialty. They do this for 2 years. Once they've finished these 2 years, then they attempt to get into residency. Once they get into residency is where you have graduated from medical school. You are a doctor, you are now a resident. Your first year residency is called your internship year, but you're still a resident. And what this is it is your postgraduate training. Your training which further helps you to identify how to understand your specialty and how to practice and most effectively use the training you have received while in medical school earlier to now become a practicing participant in the medical community outside of oversight by another doctor. Now, Dr. Cox is our program director, and he, like every other program director, oversees the training of a resident. He does not do direct care of the patient. We, as doctors, as actual physicians, do participate in our own care of the patient, but we have his oversight, his judgment, and his expertise to rely on, and not just our own understanding. What this does is it allows us to learn the trade of medicine while taking good quality care of patients and allowing them to maintain good health while we are able to get better educated. It's a big learning experience, and it's been fairly enjoyable to learn a bunch of different problems that patients have and learn the ins and the outs of those medical diseases, being able to interact with them. And then the people of Burke County primarily, as well as North Carolina, are very friendly type people. I'm originally from Tampa, Florida, and so we're a little more fast-paced and high-pressure type environment, and I like the slower environment, the more people and relationship-centered situation where I can actually get to know patients, they can get to know me, and we can have a good working relationship together to then improve their health. Some of the benefits of having a resident oversee your care, first and foremost, which I like to tell every single patient, is you always have two people thinking about you. Because when you go to another doctor, they're by themselves. Now, they may be perfectly adequate to treat you, but they still basically rely on their own understanding, where we here in the residency clinic have each of the residents ourselves, plus we have Dr. Cox or our other preceptors who are able to oversee our care. So you always have two people thinking about you. Two heads are better than one, the statement goes. So that's what I always kind of think of. However, we are currently researching every single day, looking up the latest data, the most up-to-date journal articles on what's going on in your disease states. And so we are able to apply the most accurate, most perfected, most trained knowledge in every day-to-day patient care situations. And we were able to do that searching and that researching and that trials, and then being able to put that into the patient care while leaning on the experience and the wisdom of our preceptors. There were several things that I wanted. First of all, I wanted an osteopathic program. I am an osteopathic physician, and I wanted something that was dedicated to osteopathy, which this place is. I wanted a rural clinic community-based program, which our program is. I am not an academic. I like getting in touch with patients, interacting with patients, and being able to give good quality of care to patients directly, working with them rather than at a crystal tower type of situation. So I like this down-to-earth approach to medicine. The other thing that I liked was I wanted to stay in the South. The last thing, reason I chose here was because it's a new program. I came in as its first class. I like the challenge of a new program, being able to get on the ground floor of establishing what this program will be, and being able to take part in showing the people of Burke County what a resident is, what an osteopathic resident is, and I hope I've been able to do that. We are an osteopathic clinic. What that means is we have additional training other than just your drugs and everything else, but we also have the training in the manipulation of the bones, joints, and the musculature. What this allows us to do is add another modality of treatment for patients other than just medications or surgeries or whatnot. We can actually use manipulative therapy, which is very similar to, but at the same time distinct from chiropractic. And what this allows us to do is to affect more musculoskeletal issues. The number one complaint of patients throughout the country is low back pain. Well, we are trained on how to interact specifically with how the muscles, the bones, and the joints work to, on occasion, relieve pain or at least to decrease it somewhat through our manipulative techniques. And so I think that's an important thing to know. We came to a smaller program intentionally because it is smaller, because it is that patient community focused situation. We wouldn't have chosen that if we didn't. And I think that all of us have that feeling of we want to be interacting with the community, with the patients on a personal, touchy-feely level. And I think that really becomes one of the things that I think is a plus for this program, is being able to have people who are focused on the day-to-day affairs and lives of their patients and allowing the patients to be involved in our life.